Hello, good afternoon. Hope everybody is well. For those who don't know me, I'm Richard Mills, the Chief Financial Officer, and Dr. Selwyn asked me to step in to present today's team brief in his absence as he's down under. So we've got a few bits to cover off in our usual fashion. We've got a few kind of general updates to provide just around flu and COVID vaccinations, a bit about the National Staff Survey, and an update on the NHIS email switch off as well. And then we'll also be hearing today from Dave Allen, who's our Trust Fire Safety Officer, who'll be giving us some hints and tips on staying safe over the festive period and just updating on all things fire related. So I will start off with the flu and COVID vaccination updates, if I may. So just a reminder, getting your flu vaccine really is easy. So we can do it around whenever is most convenient for you. So there's lots of options available to you. The first thing is you could contact a peer vaccinator. So there is one on most wards actually, so you probably know at least one. A full list is available on the intranet, and we'll post a little link to where you could find them. But if you find a name on there, you can just drop them a message, and then you could arrange a vaccine for any time. It just needs to be done in a clinical area, so as easy as that. Alternatively, you could pay a visit to occupational health. So if you email the occupational health email address, then again, you could arrange any time to just drop by, and a member of the team will be there to administer a vaccine. The third option is you could request a visit from occupational health. So if you're a team of 8 or more people in the same area who want a vaccine, then a member of the team could drop by to help with that. Again, if you just email the occupational health email address, then that would be able to be arranged. And then the fourth option is a visit to your local pharmacy or GP. So perhaps if you're not on site, this might be a simpler option for you. But we know that you might have already been or planned to go to a local provider elsewhere. Then that's absolutely fine as well. Would just ask though, if you could please just let us know if that's the case. And there's a form available on the intranet for you to just inform us on that. That's just so that we make sure that we're counting it and getting it included in our records. Just a reminder as well, there are some free coffee vouchers still available for the Spice of Life for those who decide to grab a jab. So that's the flu vaccination programme. We also have the COVID-19 booster offer available. So just a reminder, you're able to receive that via the ICS support mobile vaccine unit, and that's available during November and December. There'll be some availability at Newark Hospital and Kingsmill Hospital on different dates. So at Kingsmill, it will be positioned on the wide part of the pavement near the main entrance and the Women's and Children's Building. That's available on Friday the 6th of December, Tuesday the 10th of December, and Thursday the 19th of December between 10 a.m. and 4 p.m. Over at Newark, there's one day of availability there, which is Monday the 9th of December, again, between 10 and 4. If you'd like a COVID booster, then you don't need to make any sort of booking. You can just drop in. We just ask that you just make sure, please, that you have your GP details and your NHS number to hand so that we're able to access quickly your records for the vaccination team. As an alternative, you can receive your COVID-19 booster at a different location using the national booking system. So again, we can share a link to that, but there's various walk-in vaccination sites that you're able to access as an NHS colleague. So that's a bit of an update on vaccines. Just a reminder as well, there is some more information on all of that on the intranet. But if you've got any questions or concerns around it, then feel free to contact the occupational health team. So yeah, a lot of options there to get vaccinated and stay protected, to keep yourself, your family and our patients safe. Okay, I will move on. So the second item, general item I wanted to update on was staff survey. So no doubt you'll have seen loads of stuff around this, and hopefully you've all had an opportunity to make your voice count. We're getting towards the end of it now. We've got 4 days left of the National Staff Survey. So a massive thank you to everyone who's already shared their voice. As you'll be well aware, everybody's feedback is really important in helping us to make sure we're the best that it possibly can be. This year, we obviously want to hear from you more than ever before. So if you haven't yet shared your thoughts, then we've got a few days left. So please try and find a bit of time to complete the survey. It's a good opportunity for you to celebrate anything that's working well, but also really importantly to suggest any areas that aren't or that you think we might be able to improve. And we're keen for all feedback on that. And just a reminder as well, everything that is submitted is completely anonymous. The staff survey is run on our behalf by a third party, so we don't get information on who has put what in their return. Digital copies will have been sent to the email address linked to your ESR account, which could be a personal one. So if you can't find one, then please check that. Please check your junk folder so that in case it's been filtered there. For those who receive paper copies, then they should have been delivered directly to your department. If you're still struggling, you are unable to locate your survey, then there's an email address that we will share. If you contact them, then a member of the team can help. Also, if you want any more information, then there's a survey welcome pack and a frequently asked questions available on the intranet. So just a reminder, you have until this Friday, the 29th of November, to have your say. So please do try and find the time to complete that. I think depending on the amount of comments you put in, it's probably 10 to 15 minutes, and your line manager will give you protected time to complete the survey. Okay. So NHIS email switch off is the third item that I just wanted to update on. So you'll have seen updates before confirming that NHIS are removing email support requests from the 1st of December 2024, so next week. You can use the NHIS IT customer portal instead, so that replaces the email system and ensures that the necessary information is provided when you log in new requests with us. So hopefully avoids a bit of email traffic for everybody. The NHIS IT customer portal is provided when you log in new requests with us. So it enables some of the requests to be automated, which gives the NHIS analyst a little bit more time to deal with some of the phone requests and hopefully leads to shorter phone wait times. The portal should be accessed for all requests, as I said, from the 1st of December, and everything you need from NHIS can be logged via the portal. So there's specific buttons on there for whatever your request is, and that enables the most effective solution to be found by NHIS. So if you're unable to find what you're looking for from those pre-selected options, then just select that you're unable to find a tile, and someone will be in touch with you. To log into the customer portal, you just need to use your nhs.net details. So basically, however you log into your email account, then that will be the same for the NHIS customer portal. So yeah, please do use that to report anything IT related that is broken or no longer working correctly. So some examples of things that you might want to talk about is any IT advice or access to certain systems or certain folders, any new IT accounts or any changes to accounts, any software or hardware installation, or any training, viewing the status of your logged faults or requests in real time, viewing knowledge articles and training or self-help guides to find solutions to common problems and queries, or to view any news or urgent announcements from NHIS. There's a quick reference guide that NHIS have also published as well, just to help you to find the right button on the portal, which again, hopefully we'll just be able to pop that one into the Q&A chat so that you can access that. Finally on that NHIS update then, so you can self-help your smart cards, Windows and NHS.net passwords. So there's a system called Care Identity Management. So if you log into that, you can unlock your smart card or set a new passcode. You can also log into Microsoft Online Password Reset if you want to reset your NHS.net email account password. And you can register for your reset to reset your Windows password. And you can find out how to do this in the 21st of November bulletin article. So some of those common problems we have when we've been on leave or been on a long weekend and forgotten our passwords, then plenty of options there for you to self-serve and reset them yourselves. Obviously, you can always phone the NHIS service desk as well on 01623 410 310 or internally on 4040 if you need to escalate any high severity faults after being raised in the NHIS customer portal, and if you quote the call reference number. Any queries on any of that stuff, then please contact NHIS Project and Business Support Change Manager Helen Benfredge, or the NHIS Service Desk Team Leader Jackie Hawkins. Okay, so I think that is it for the general updates. So I will move on to Dave and introduce Dave. As I said at the start, Dave's our Fire Safety Officer for the Trust. So, welcome, Dave.
Thank you very much, and thank you for having me. For those who haven't had the opportunity to meet me yet, as Richard has just said, my name is Dave Allen. I am the Trust Fire Safety Officer for predominantly Kingsmill and for Mansfield, and a colleague of mine looks after Newark site. What I wanted to come on and talk to you about today was a project that we're working on in the fire safety team, and we're going to be putting out some tips and tricks for over the festive period, how you can help keep the safety of your wards and departments as paramount from fire. We're going to be posting those via the #SFH Facebook page and also via the bulletin too. There'll be plenty of opportunities for you to identify how you can do small things just to keep you and your staff safe. These are just small things such as making sure that you're not hanging any sort of decorations in way of any sort of emergency signage, and some of the provisions that are provided for you for safety by the Trust. So look out for those coming very soon. I'd also like to just have a quick chat about a new course that's recently been launched by the fire safety team, and that is surrounding the training that's available for people who might be in control of a particular place, whether that be a supervisor, whether that be management, maybe ward leaders, and it's a course that's been put on via the Sherwood Academy. You can book on it through there, and it's labelled Managers Fire Safety. So it's not necessarily just around managers. As I say, it is for anybody that might be in charge of an area, and it helps to identify things that are under your control, let's say, and what's required of you as an individual, and it helps to identify all that sort of information. So that's available to be booked now using the code Managers Fire Safety, or if you want to put in an actual code, it's HS47. And also, we want to make sure that everybody's getting the most up-to-date information too, not just via our mandatory training, but also via our intranet page. And we are relaunching, or we're doing a project at the moment to relaunch our intranet page, and in there you'll find lots and lots of information that we can do. So just want to say thank you for the opportunity just to come and speak to you. If anybody's got any questions, please place them in the chat, and I'm sure one of the team will forward them on to me.
Okay, thank you, Dave. While you've got the floor, any other key messages you'd like to get across around fire safety? I think you covered it all.
Predominantly, I just want to make sure we are going around all wards, departments, etc., just to make sure that everybody's doing everything they can to make sure that everywhere's safe. But please if you are having any issues, or if you want some help and support, please reach out to us. As I say, we are visiting all wards and departments at the moment. I know I visited a few yesterday. And the key message is mainly about your evacuation routes. Make sure your evacuation routes are clear, because whilst we might think that we're really protected being in a healthcare environment, it just goes to show that fires do happen in a healthcare environment. Those of you that's been on a recent training course of mine will see that I give a statistic where during the year of 23-24, there was actually 500 actual fires in healthcare settings in the UK, which is staggering. And I saw on the news yesterday that just over the weekend, there was a small fire in the ED department at Queen's Medical Centre. So, these things do happen. We will do everything we can to prevent them from happening. But if they do happen, for whatever reason, we want to make sure that all our staff, patients and visitors are safe as possible.
Brilliant. Thank you, Dave. And just to remind everyone as well, really important that we keep up to date on our mandatory training around fire safety. So Dave kindly came along to a team brief in our finance team to deliver that to the whole team, which is an option if you're part of a larger team, to try and get Dave or someone along just to cover that mandatory training off. Really important that we stay compliant on that.
Absolutely. If you do need any help, support with your teams, please just reach out. One of us will be in touch, and we're more than happy to help.
Brilliant. Thank you, Dave. Okay, I can't see that we've got any questions through for you, Dave, but if you're happy just to hang around in case any others pop up for a few minutes, that'd be useful. Okay, brilliant. Thank you. So I'll just update on a couple of other bits just while I've got the floor. So as the CFO, I'm also the executive lead for estates and facilities as well. So I just wanted to start by acknowledging and apologising for some of the parking issues that we had last week with the snowy weather conditions. So we do have plans and we do have processes in place for when we have adverse weather conditions and when we have snow. Unfortunately, those plans weren't quite executed the way that we'd have hoped and the way we'd want, which I know meant that a lot of colleagues had real difficulties with parking last week, particularly in the snow. So apologies for that. We'll provide some more updates as well in due course around how we plan for that and how we will look to avoid those kind of issues in the future. So I just wanted to share that. And then also I just thought it'd be helpful just to provide a little bit of an update on the financial situation at the trust as well. So again, we've mentioned this in the bulletin before, in the team briefs before, and in the blogs. But the NHS as a whole is under real financial pressure this year, as many of us faced in our personal lives. Inflation over the past couple of years has been pretty significant, and really affecting the NHS, and in particular the impact that we've had in dealing with COVID and the additional investment that went into the NHS over the last few years is really starting to bite now in terms of paying some of that stuff back. So just a reminder that for this financial year, we were due to spend £14 million more than what we earn in income than what we're allocated. So a 14 million deficit was allowed by NHS England as a one-off for this financial year. But even to deliver that, we've got a huge savings target of £38.5 million to deliver this year. So that's about 7% of our operating expenses. You might hear that talked about as financial efficiency. You might hear it called our FIP or our financial improvement program. Basically, it means us trying to spend less money than we've been spending in the past or generate more income than we have done in the past. So a real challenging position. I'm pleased to say that we have been making some really good progress around this over the past couple of months in particular. So over 7 months, we've managed to deliver £21.1 million of efficiency savings, which is really, really good news and helps us to deliver that financial plan that we set up to deliver for the year. We're about £1.88 million ahead of where we'd have expected to be at this year, but we're not quite out of the woods yet. So our forecast, what we're expecting to save over the remainder of the year, becomes challenging as obviously we go into the winter period and see some increasing in some increasing cost pressures over the next few months in relation to seasonality. So we've still got about £17 million to go at for the rest of the year, which is really, really difficult. There'll be a cascade coming out to line managers that just gives a little bit more information and a bit more flavour around some of those savings that we've been able to make, but also importantly what you can do, how you can play your part. And one of the key things really is just about sharing ideas. So when it comes to financial savings and efficiencies, there's no idea is a bad idea. So if you've got a thought, if you've got an idea, then speak to your line manager about it, or contact your finance manager about it. You can make a service improvement suggestion via an online form on the Improvement Faculty's intranet page, or you could contact Joanne Lancaster in our finance team. She's available on joanne.lancaster2@nhs.net, and she can arrange for someone from the finance team, or she can come along to a team meeting or to meet you directly to just talk about any potential savings that you might have. Really important that we do hit our targets. If we don't, there's a risk that some of our decision making might be taken away from us. There is potentially a risk around access to some national funding. So in recent years, we've been successful in getting national capital support for things like the new theatre that we had over at Newark, our community diagnostic centre that we're building at Mansfield Community Hospital, and also the electronic patient record system, which we're currently going through the business case process for. So they're the kind of things that we might be limited in the future to access those kind of pots if we're unable to hit our financial targets. So really important that we're able to deliver that. Okay. So I think that's it. I can't see if there are any questions that have come through in relation to any of the topics that we've discussed. I'll just give it a minute or two in case there is anything. No, I'll just look for a comms colleague to confirm. Okay, so I think we might be getting a question through about car parking. So yeah, so there's a question about sorry, just let my IT catch up. So a question around the ANPR, so the advanced number plate recognition. So and particularly around the car parking capacity that we've got in place. So one of the things that we've seen in recent months as the public car parking barriers haven't been working properly. It's been a bit of a free-for-all, to be honest, in the public parking spaces. So we have had a number of staff members parking in public car parks over recent months. I think now ANPR is in place, which means that public charging is back in place. Then we are seeing more demand for our staff parking spaces. So I think the question here is just about any plans around parking capacity. So we're exploring options, I think is what I'd say around that. It's really difficult because we don't have particularly much space on our estate to put in additional car parking spaces. But where we do, we are looking at whether we can do that. That includes whether we can mark out spaces in some of the areas that we've currently got, for example, the gravel car parks. I think if we're able to mark out some specific spaces in there, we could potentially fit more capacity around those. We're also looking at whether we could convert the area that was previously used as the helipad into a car parking area. But the work on that is ongoing. We do have a car parking group, so if anybody does have any good ideas about how we might be able to increase parking capacity, then please do contact the car parking team and Julie Dennis in particular, and we can look to explore that. I suppose the other thing that I'd say is we need to think about any opportunities to reduce the need for car parking as well. So any opportunities that people may have to find alternative means to get into work, be that through car sharing, be that through using public transport or cycling into work. If anybody's got any ideas about how we might be able to increase that and improve on that, then please do raise those as well. But yeah, appreciate it. It has been really tight over the last couple of weeks on staff parking. Okay. Okay, so I've just had confirmation. I don't think we've had any other questions. So yeah, we will call it a day there. Thank you everybody for joining us. I hope you enjoy the rest of your day and have a good week. Thank you.